Good morning, everyone. I suppose, first of all, I'd like to say thank you to Sharon for inviting me here to talk today, and thanks to Obacare for providing today, which I hope will be of great support to everybody. My name is Sheilah and I work in the Mater Hospital. So I'm just going to start by talking about the role of the Oncology CNS, or maybe the background to where clinical nurse specialists come from. It's a role that's been recognised in America since the 1960s. And in the UK since the 1980s, but it's relatively new in Ireland, and I think it's very fortuitous that it is now in Ireland. In 2001 we had the first framework which recognised the fundamentals and roles of the nurse specialist. So we're nurses that have an expert knowledge, skills and experience within a specific area of clinical nurse practice, and we're educated in nurse education relevant to that area of specialist practice. So the key role of the nurse specialist is coordinating the care of the patient, liaising with medical staff and other healthcare professionals, and educating patients, empowering them with skills required to effectively manage their illness and treatments. In 2010, the SCAPE project was initiated to look at the role of the CNS and how it affected patient outcomes, and they came up with quite a few different things that I think does mean that we are beneficial within the healthcare system. It showed that there was evidence of improved adherence to treatment, increased knowledge, prevention of complications, health promotion, psychological wellness, advocacy and therapeutic relationships. But the reason why we're here today is to talk about ovarian cancer, and I think it's important that we look at the prevalence of ovarian cancer and how it's diagnosed. And I think June and Pauline touched on that it's a hugely shocking illness because patients aren't prepared for it, and they may well be attending their general practitioner for a number of months with IGLs that I suppose as women we all complain of, and it may not be related, or the GP may not feel it's related to ovarian cancer. The National Cancer Registry shows that ovarian cancer was the 4th most common cancer diagnosed in women in Ireland between 1994 and 2010. On average, there's about 350 cases a year in Ireland. And unfortunately, many women present with ovarian cancer at a later point in their disease. It's commonly termed as the disease that whispers, and I think that's quite true. 40% of women diagnosed with ovarian cancer are alive 5 years from their diagnosis. So just to say what happens, I suppose our pelvis can hold quite a lot. Obviously anyone who've had children knows that it can hold a lot. So tumours can grow unnoticed deep within the pelvis. They can grow quite large before they're detected, and that's why the symptoms are therefore vague, leading to a delay in diagnosis. It usually only becomes apparent when the disease or the tumour compresses or invades adjacent structures, or when ascites or fluid becomes evident within the abdomen. I suppose it's a common thing that would be said to me as a nurse specialist from patients is, but I've been going to my GP and how am I only being diagnosed with this now? But I guess it's important to say that GPs may only see one ovarian cancer diagnosis every 3 to 4 years, so it's something that perhaps general practitioners are not that quite clued into as well. And the next slide just shows, quite worthy, so I'm not going to go into it in detail, but a lot of the symptoms of ovarian cancer, such as abdominal bloating, fatigue, pain, urinary frequency, and I think it was Pauline who touched on that she thought she might have had a urinary tract infection. They're symptoms that can be related to less serious illnesses, and therefore it may take some time before an ovarian cancer is actually diagnosed. So how do we reach an ovarian cancer diagnosis? And any lady here today who's been diagnosed with it will probably be familiar with these stages. Initially the woman presents to the GP and it goes through the history of what she's been experiencing. The GP may examine her. There may be a detectable pelvic mass or abdominal mass at that time, and then ultimately the GP will go on to do investigations in the form of x-rays or ultrasounds. At that stage, if an ovarian cancer is suspected, the lady should be referred either to a general gynaecologist or a gynaecologist specialising in ovarian tumours. At that point, more intensive x-rays will take place in the form of CAT scans, surgery may take place, but ultimately the diagnosis is made with histology. And following that diagnosis, we do a multidisciplinary meeting to confirm the diagnosis and where we go from here. So this is, I guess, where the clinical nurse specialist comes to play, and I think it's important to highlight that despite providing the right setting, perhaps, although in some hospitals it may not always be the correct setting. I know our old outpatients department in the Mater wasn't exactly the right setting. We do have a nice new outpatient setting, so it's nicer at the moment. But despite providing that and the manner of communicating bad news, or what and how much information we provide and emotional support, I think this slide would resonate with most people, that generally all you hear is the word cancer, and outside of that, on initial diagnosis, it's very hard to take anything in, especially as a lady has been having kind of vague symptoms for a period of time and suddenly you're being told you've got cancer. And what follows then is, I guess for most people, quite a roller coaster ride between the diagnosis, surgery, chemotherapies, and the ins and outs and side effects of all of those treatments. All aspects of life are changed, and I think I'm not quite the right person to highlight how life changes, but I certainly think June and Pauline very well indicated to us how things change in life, physically, through surgery, pain from surgery, hair loss during chemotherapy, tiredness, perhaps nausea. It can be very hard for life to be normal, especially during that period of time when you're on treatment. Emotionally, I suppose it's extremely difficult to suddenly be catapulted from a normal everyday life, getting on with if you're out working, or if you have a family or whatever you're doing in life, and suddenly you've been told you've cancer and you have to go through all the realms of what that involves. Sexually, I think, is something that I would feel as a healthcare professional in the Irish context, it's not something we openly talk about, and I suppose maybe healthcare professionals struggle with that, as does the patient themselves, and I think that's where a clinical nurse specialist can be your advocate and can be someone to talk to if there's difficulties. It can be hugely difficult in the premenopausal setting or in women who haven't started a family yet, and certainly that can be extremely daunting. But outside of that, for the postmenopausal woman, there's still a lot of fears for the woman themselves have, but perhaps their partners have as well, and I think it's something that we need to openly talk about, and there are a lot of resources and guidelines there to help people with that. Spiritually, certainly people may find that they turn very much so towards their faith, but other times you may turn away from it, but certainly having some sort of spirituality or faith, a lot of people would find that really gets them through the diagnosis. Financially, I think Pauline again really reverberated how that can impact on everyday life, not only if you're the income earner of the family, but even if you're the homemaker. Understandably, any illness has a financial impact. And then family role, I think we've talked about that a lot this morning as well, and I suppose it's something that we really need to focus on. That, I mean, ultimately ovarian cancer does affect the woman themselves, but it does have an overriding impact on all the family members or anyone close to you. And then survivorship versus recurrence, I guess that's a question that we can't move away from. Understandably, it's a question that everybody asks, and unfortunately a lot of people can't give an answer to it because we're all individual, and no one has the answer to that. We certainly see women living with ovarian cancer for considerable amounts of time, and nobody can tell you whether or not or when the cancer may recur. We do know that ovarian cancer has a high chance of recurrence, but those are statistics, and we don't know what statistic we will fall into as individuals. So the resources that are available to patients with, or ladies with ovarian cancer, we've the specialist team, I'll go through that later, psychological and psychosocial supports, the specialist nurse. It's very important to access supports that are available within the community and to utilise those: counselling, exercise and diet, and palliative care. So this is just a number of the people involved in the care of the ovarian cancer patient. The gynaecologist, medical oncologist, radiation oncologist, the histopathologist, radiologist, specialist nurse, palliative care, social work, psychological care, psychosexual counsellor, dietitian and a physiotherapist. I'm sure not everyone sees all of these people, but they're involved along the way, maybe in the background, or if people feel that they need them. So just touching on a few of the different supports, I know Anne later after my talk will probably give greater insight into these different areas. I guess it's important to say that cancer is not your fault. 1 in 3 people in Ireland are diagnosed with cancer. I think it's important to say that in anything in life we don't have control over it, and it's very hard sometimes to have answers to it. They can be the unanswered questions, I suppose. Cancer affects all aspects of life, and it's normal to feel overpowered by this. The topic of menopause, I suppose, is something that comes up a lot, especially in women who are going to be put through a surgical or treatment-induced menopause prematurely, and that can have huge consequences. It can serve as an ongoing reminder of the cancer, and it's obviously devastating in women of childbearing age. So it would be important that if these things are becoming overpowering, then certainly to access counselling or written literature, or discuss the options, the merits or risks of HRT with the doctor. I don't know, Pauline, if this resonates. But I think it might highlight some of the symptoms of the menopause. Altered body image. I think breast cancer patients tend to focus on this a lot after mastectomies, and that it can be something, you know, that they focus on the effects as your feelings of being a woman. But I think certainly, all of you ladies here today affected with an ovarian cancer can certainly say that our perceptions of femininity can be greatly impacted by having our womb or our ovaries removed. So although we may not see it from the outside, it certainly has huge body image issues that arise. Hair loss due to chemotherapy, or perhaps weight gain or weight loss. All of these things can have a huge impact on a person's well-being. I've already touched on sexual function, with all of the things that can impact on that, such as fatigue, pain, hormonal imbalance due to the menopause, or I think a big factor in it is fear. It's something that we don't talk about, and absolutely sex is possible after an ovarian cancer diagnosis, but again, it's something we don't talk about. So it's important that everyone with an ovarian cancer diagnosis know that there is someone to talk about in regards to it, so that we can allay any fears associated with it. Relationships with family members and friends, family distress relating to a diagnosis. This can have a huge impact on quality of life. I think the problem most people would say to us is that from the loved one's perspective, maybe the partner or the husband, is this feeling of they're not sure if they can help or not, and this feeling of isolation. So it's important, I suppose, to openly communicate and to talk to your loved ones. Daily functioning of work, pain, fatigue, depression, related treatment-related symptoms can have a huge impact on when we may get back to work or back to normal functioning. And I've touched on financial concerns and spiritual well-being. Research would suggest that religion or spiritual faith has a positive impact on our quality of life, and I suppose that can take any form. What kind of spiritual we go down, but it can certainly have an impact on our quality of life. I guess this slide, you're probably wondering what it means, but it's just to point out that we are all individual, and society and the media does tend to focus on the horror stories. You know, whenever anyone gets a cancer diagnosis, you immediately worry about your mortality, because that's what the media focuses on, or the internet focuses on. But I guess what I want to say today is that we're all individual, so none of us know what journey our cancer will take. So it's important to remain positive, I suppose, even though I'm not a big fan of the word positive. I think we have to do this in whatever way is right for us as a person themselves. This is just to say that it's important to be educated, and I suppose this is where the clinical nurse specialist comes into fruition as well, in that we can provide plenty of written information, or just information. We're at the end of the phone, or we should be at the end of the phone for you once you've been diagnosed. But I think it's important to be educated and aware of the disease, so that you can be proactive in your treatment and your treatment choices. I like this slide. It looks good to me. I don't know if you can see it, but it's just to say that it's really important to pamper yourself as well. We're throwing an awful lot of difficult treatments your way, be it surgery, chemotherapy, and there has to be time out from all of that as well. And it's important to nourish our minds and bodies as well, so that we can face it. And diet and exercise, I suppose that's something that we're told, no matter whether you have a cancer diagnosis or not, eating well and getting plenty of fresh air and exercise is important as well. Whether you feel up to that or not is another story. And then counselling, I think, is very important. Certainly, I would have a lot of ladies coming in to say that it definitely empowered them throughout their treatment, and I think it's important to say that it's not a sign of weakness if we feel that we need counselling, because it's very likely that we will mourn that sense of loss when we're faced with an illness like this. So I think that going down the route of counselling may be actually something that will empower you to live life outside of the treatments and outside of the diagnosis. So it's certainly something that I would encourage, and I'm sure Anne will touch on it later as well. These are just some of the different supports that are available within the community, and certainly I would feel as a nurse specialist working within the hospital setting, we work within the hospital and don't go outside of that remit. So we're available at the end of the phone, but I think all of the support services, and these are just a few available across the country, are huge to the support of ovarian cancer patients, but also all cancer patient sufferers, because of the different supports that they provide, be it counselling or complementary therapies. But I think the biggest support when dealing with any cancer diagnosis is for you together, so the patient themselves talking to other patients, because nobody knows what it feels like except for the person who has gone through it or is experiencing it. So just to finish off on psychological and psychosocial supports, it's important that if you do have children, that you speak to a social worker on how best to communicate with them. This is what they're trained to do, and they can give a lot of information. Depending on the age group of the child, it can be a very harrowing time as to when to tell them, if you should tell them. So I think certainly just to be aware there is supports there to advise you on that. Surround yourself with people who support you. And it's funny, actually, a lot of people will say to me that the friends that they thought were their closest friends may not, in this time of their lives, be the person that they thought they were. And you might find support from places that you don't suspect. So just to be open to that. And then just to reiterate, to communicate with your nearest and dearest. It impacts on the family and relationships as a whole. And persons, I suppose, males and females react very differently in all aspects of life, but certainly at stressful situations. So without communication, there's loneliness and frustration, and loved ones who feel they can't help. And your medical team are there also to help you explain your illness to your family. So the specialist nurse, a study in Chicago has proved that having a specialist nurse involved in your care increases compliance with guidelines, increases consultant review, and decreases the need for unnecessary tests. Everyday access to a specialist nurse means immediate access to your specialist team and allied health professionals. I think that's ultimately what our role is, you know, and not making it very basic, but I think it's the knowing that someone's at the end of the phone, that you can make contact with the relevant doctor, or just get the right answer to your query while you're at home, and just being able to ring someone and get immediate answer, I think, is hugely helpful. It gives knowledge to divert your issue in the correct direction, and it's a link between hospital and community care. We support the individual coping strategies and promote social support networks, emotional support at the time of diagnosis to the woman, her partner and family, access to immediate hospitalisation if it's required, coordination of your treatment, we expedite scans if necessary, and we're a knowledgeable resource regarding your individual illness, advice and reassurance about various symptoms. And we monitor your treatment pathway and ensure that treatment commences within guideline recommendation. We're someone to voice your particular concerns at your case discussion, and we introduce discussion about effects on surgery and sexuality as appropriate. I think ultimately we're someone here to listen to you, and exploration of social role, for example, returning to work, financial impact, role in family and hobbies. So these are just a a few common questions which come up from time to time, and I think later on this afternoon there will be an opportunity to talk to various people working within ovarian cancer, so there may be things that will be answered for you today. Questions such as the internet and what sites are appropriate. I think that's a common question, because Googling things can create a lot of anxiety, so I think we need to link in and know what sites are appropriate to be looking at. Complementary therapy, specialist diets, research and clinical trials. A common question is, if I travel, will I avail of better treatment? I think it's important to highlight that we do work within international guidelines, and I don't feel they're doing anything different across the pond, so that's reassuring. CA125 and its role and monitoring. I have symptoms, is it a fear or is it real? Have I caused my family to be at greater risk of developing cancer? I never met other women with the same cancer as me. I think that's where Overcare has to be commended, that this is a fantastic forum for people to get together and share their experiences. And I suppose the most common question is, will my cancer come back? And again, if I can just reiterate how individual everyone is, and I suppose these are questions that can't always be answered. So finally, I'd just like to say thank you. Today gives a voice to ovarian cancer. It looks beyond the illness and focuses on the well-being of the woman. It's a very positive step in creating awareness and advocacy for ovarian cancer, and it's about you, the persons touched by ovarian cancer. Thank you.
Thank you, Brian, and thank you to all of you in Overcare for inviting me to speak this morning.